Many of my patients with chronic pain also have anxiety disorders. Fear and anxiety are normal biological responses of our body. However, when they are excessive, they need to be managed and treated. Fear is an emotion that we have when we perceive something that seems dangerous. And anxiety is an emotion that we have when we anticipate a situation that can be dangerous to us. So, in simple terms, fear is quick and related to something in the present, and anxiety is prolonged and is related to future time. In patients with chronic pain, they usually develop fear and anxiety related to pain. People with chronic pain are familiar with an ongoing baseline pain sensation, but when there is an acute flare or a new pain, they are afraid of what's going on. Then they start worrying about the future and anxiety starts popping up in their head. Today, I will show you a quick technique to relieve excessive anxiety. It doesn't cost any money, you can do anywhere, as many times as you want. So let's talk about square breathing today. We'll use a breathing technique that is called square breathing or box breathing. First, let me explain why we use breathing to reduce abnormal fear and anxiety. Fear triggers our sympathetic system to release stress neurotransmitters and hormones. Noradrenaline is released very quickly. It is the fight or flight neurotransmitter that makes our heart to beat faster, increase our blood pressure, breathe faster, boosts our energy so we can fight the danger, opens our pupils so we can see better, and sends more blood to our muscles and brain. Cortisol is the stress hormone. It's released much slower than noradrenaline. It increases sugar in our blood and improves the brain ability to use that sugar to think faster. It reduces body functions that are not supposed to occur when you are in a dangerous situation, such as appetite, sex drive, digestion, and sleep. These two substances, noradrenaline and cortisol, are essential to survival. Without fear and anxiety, without noradrenaline and cortisol, humanity would not have survived until now. Let's go back to the patient with chronic pain. Now, the person is having a pain flare-up, a new sensation, and it seems that this is not going away. The brain will activate the fear and anxiety centers. More noradrenaline and cortisol will be released. The person will start thinking more and more about pain, their future, and the consequences. There are mainly three areas that the person will worry about. They will be ruminating, that's ruminating thinking, magnification of pain, and feelings of hopelessness. Here are some examples. Ruminating, for example. I cannot seem to keep it out of my mind. Examples of magnification. I become afraid that the pain will get worse. And helplessness. There is nothing I can do to reduce the intensity of the pain. There are many techniques that we can use to help the person who have these thoughts. I usually recommend them to speak to a psychologist. The psychologist can help them to see these thoughts as unhelpful, but I understand that there are many people who do not have access to a good psychologist, and unfortunately, there are few psychologists who are trained in the field of chronic pain. So I'm going to do some videos showing techniques that I recommend to my patients. They do not replace a good psychological support, but they can help some people, especially in situations that the patient recognizes the fear and anxiety triggers their pain, or vice versa, that the pain triggers their fear and anxiety. Let's start with square breathing. First, find a comfortable position. Usually I recommend a chair, but you can do this anywhere, even lying down or standing up. If you have never done this, start with a pencil and paper. Once you learn how to do it, you don't need the paper anymore. You can do it even with your eyes closed. We are going to use breathing because we want to activate the parasympathetic nerve system. The parasympathetic nerve system is the opposite of the sympathetic system. The parasympathetic system is the rest and digest nerve system. It does the opposite of the sympathetic. It reduces the pupil size, slows the heartbeat, relaxes the muscles, closes the airways, promotes digestion, relaxes the bladder, and stimulates salivation and sex drive. When we activate our lungs and forces our respiration to slow down, we are sending signs to our brain that there is no danger. There is no need to be super afraid and anxious. We are telling the brain that we are okay. We are training the brain to calm down and stop the sympathetic release of noradrenaline and cortisol. We are going to do 5 cycles of square breathing. Each square has 4 sides. We start by breathing in for 4 seconds, then we hold our breath for 4 seconds, then we breathe out for 4 seconds, and we hold for 4 seconds. That's 1 cycle. So let's start. You breathe in, 2, 3, 4. Hold there. 1, 2, 3, 4. Now you breathe out. 1, 2, 3, 4. And hold. 1, 2, 3, 4. That was cycle 1. Let's do the same thing for cycle 2. Breathe in, 2, 3, 4. Hold, 1, 2, 3, 4. Breathe out, 1, 2, 3, 4. And hold, 1, 2, 3, 4. That was cycle 2. Let's start cycle 3. And hold. And breathe out. 1, 2, 3, 4. And hold. Let's do cycle 4. Good. So we did 5 cycles. There is no need for you to pause between the cycles. You can just continue doing the squares 5 times. That's it. Now you learned a new technique that you can use when you feel excessive fear or anxiety related to your pain flares. Write in the comments below if that has worked for you or not. Please don't forget that this video is for educational purposes only. And if you have a condition that needs medical or psychological advice, please talk to your doctor or seek a psychologist. And if there is an emergency, go to the nearest emergency department. Don't forget to subscribe to this channel and watch my next video here. Bye!